brain tumor, that is something growing in the brain, and it can cause damage through its growing then, and also through the increased pressure then in the brain, because the brain is confined within the skull. And the symptoms are then problems with, there can be partial loss of vision, numbness, vomiting, headache, increasing drowsiness, and the first sign may be epileptic seizure. In children also unsteadiness of the feet. The headache by children is slower developing because the skull is a little more elastic. The causes, it can spread from the meninges, the lining between the brain and the skull, and it can be secondary tumors, so cancer somewhere else in the body, in the kidneys, the lungs, the colon, the ovary, can spread and make then the secondary tumor in the brain. And if it is suspected, then there can be made tests, x-rays of chest and brain. It can be looked at the back of the eyes. It can be made EEGs and CATs and MNRs and so on. And the outlook depends. Some can be removed with surgery, and then it's quite good, the outlook. Others are more serious, even also with permanent damage. And the earlier detected, the better, when the damage caused is small. That is according to Keith Hodgkin's Family Medical Advisor book on the page 99, but this is no medical advice. Hi and welcome. I'm trying to learn medicine today, brain tumor, and after we've done with it, we're going to do arm strength training. And if you participate in the arm strength training, then it's with young mask. And we're talking about diseases, I haven't read it, internal anatomy, tumors, and this is no medical advice, I haven't even read it, so I'm just trying to read and to understand it. Brain tumor. Because the brain is confined within the skull, which cannot expand, a growing tumor increases the pressure within the skull. The brain is inside. How much space has an average brain left to grow? So basically the question is, how tight is it in the packed? And would it be helpful to know it medically? Would the brain get larger if it would have more space? But I don't think a person would be more intelligent if the brain would be just a bit larger. No, because the brain is confined within the skull, which cannot expand, a growing tumor increases the pressure within the skull. This is the problem. So a tumor is growing, and there is not much space. The tumor is taking space away, and the pressure increases inside of the brain. Symptoms of the book is from the 1970s. Symptoms of brain tumors may result from a direct effect of the tumor on the nerves of the brain, or from the increase in pressure within the skull. So the tumor can either affecting directly the brain, or the tumor can just make it more tight, and that pressure can have a problem onto the brain. They will depend upon which part of the brain is affected. Brain tumors do not spread to other parts of the body, as do malignant cancers that develop elsewhere. So cancer elsewhere is spreading through the body, but cancer or brain tumors are not spreading. Doctors often refer to brain tumors as expanding lesions of the brain. Symptoms. An epileptic seizure in a person over the age of 30 may be the first symptom, so an epileptic seizure. Muscle weakness or lack of coordination. Personality changes, increasing drowsiness. I don't really know what it means. Loss of balance or loss of part of a field of vision. Headache and vomiting may indicate increasing pressure. The headache is worse when cawing or lying down. It may be particularly severe in the mornings. Tumors in children may affect the cerebellum, the area of the brain controlling coordination. The child will then become increasingly unsteady on his feet or her feet and have flickering eyes. Headache and the feeling of increased pressure within the skull often develop slowly in children because their skulls are slightly elastic. Okay, what we said here, we said the first sign could be an epileptic seizure. It can be How How long does it on average take to detect that someone has a brain tumor? Epileptic seizure, muscle weakness, lack of coordination, personality changes, increased drowsiness, loss of balance, loss of part of field of vision, headache, vomiting. And children can have also then more coordination problems, and it can take longer until headache, then increased pressure, feeling develops because the skull is a little bit more elastic. Duration. Extremely variable. Many brain tumors are slow growing and their development is difficult to recognize. Okay, they're growing slowly and it can be difficult to recognize, but not if the symptoms are shown. If the person taking care of each other, not. And don't brush them aside. Most take from 1 to 6 months to develop, some may take several years, so it can be a few months, it can be a few years. Causes. Brain tumors may arise from the nerves of the brain itself when they are called gliomas. Do we have gliomas here? No, we don't have it. We have glaucoma, disease of the eye. So it can be caused through the nerves of the brain themselves. And they meaning then they are called gliomas, because they certainly don't get becoming tumors because of being called gliomas. I'm not really asking for a book, I'm just asking generally, just language basic, on the language basics. When they are called gliomas, would it not mean and then? It would make more sense, I think, but okay. Tumors may arise from the meninges, the lining between the brain and skull, or spinal cord and vertebra. These are usually called meningiomas. So the arising from the meninges, that is the lining between the brain and the skull, or spinal cord, or vertebra, and they have been called these tumors meningiomas. Cancers elsewhere in the body, particularly in the lung. Why is it called brain tumor if it is a cancer? Cancers elsewhere in the body, particularly in the lung, breast, kidney, ovary or colon, may spread to produce a tumor or tumors in the brain. These are called secondary tumors. It is cancer there, and that spreads into the brain, and there are tumors in the brain also. Complications, permanent brain damage. Treatment in the home? None. When to consult the doctor. If any of the above symptoms occur, or if you have headaches and fear you may have a brain tumor. So we're saying if you have headaches, consult the doctor, but also epileptic seizure, muscle weakness, lack of coordination, personality changes, increasing drowsiness, loss of balance, vomiting, lack of coordination. What the doctor might do: check for abnormal reflexes, numbness, and muscle weakness. An examination of the nervous system, particularly looking at the back of the eyes with an ophthalmoscope, may reveal signs of a tumor. Arrange skull and chest X-rays. More sophisticated tests such as an EEG, NMR scan or CAT scan may be advised if there is evidence of a tumor. Some but not all tumors can be removed by an operation. Some secondary tumors, for example from the kidney, may diminish or even disappear if the primary tumor is removed. Outlook. The outlook depends upon the type of tumor. Some can be completely removed and cause no further problems. Others may be much more serious and produce rapid deterioration. Early diagnosis and surgery, when possible, to remove a tumor reduces the extent of local damage to the brain and nerves. So the earlier the better, reduces the extent of damage to brain and nerves. But it depends on the type of tumor, the outlook. Some can be removed. Others are more serious and produce deterioration. That was the medical part. If you're here for medicine, you can go directly to the next part of medicine, where we're going to do at one point again with brain tumors. Read it on again. And if you stay here and participate in the arm strength training, where is it that you can I don't know, start. Good and standing next. And breathing in and reaching the fingertips as possible. Hold it down again. And reach up front. High up. Down. And the flail exercise. If this causes pain or discomfort, then don't do it. Long arms or fists and circle the wrists. And and next exercise. Arms out and press the fingertips together. Have a little bend in the elbows. And if there's at any time pain at the elbows, the wrists, the fingers, or in particular the finger joints, stop immediately. And you don't have to do this with full force. Rather not. Your arms are stronger than your fingers, or your finger joints. And the next exercise. Now a little bit longer fingers. Again, little bend in the elbows. And if there's at any time pain at the wrists, elbows, fingers, or finger joints, will stop immediately. And the next exercise. Press with the fingers into the finale and hypophyna of the hand. If this causes damage at the skin or at the nails, then don't do it. Press and leave in. Only if it works with the rest of the ankles. Press again. And press. And press. One more time on each side. Press. And press. Now with other arm. Like that. With the left arm on top. Press. And get outside. And again. And last one. And now the arm out and press again. And the arm. And again. Out. And now the next one, the square. Press, not too much. If it causes discomfort at the wrists or pain, then don't do it. Over. Up. Over. Down. In. And back. Over. Over. Down. And the long one. Again, not full force. And backwards again. And now circle, no, backward. And the arms to the side. Now circle the arms. Backwards. And one arm in front, shoulders back and down. Pull the arm in, have flat fingers, relax the arm. Go a bit back with the shoulder, turn the palm up to the sky. Other arm. Arm in front, shoulder back, down. Pull the arm in, have flat fingers, relax the arm. Go a bit back with the shoulder, turn the palm up to the sky. And go with moderate pressure over the middle part of the lower arm. And on the other side. And a bit more slow. I was strengthening. I thank you very much and until next time.